Hi friends, I'm Dr. Dattaram. I'm a consultant surgical gastroenterologist and a laparoscopic surgeon, GI cancer surgeon practicing in KIMS Hospital, Gachibowli, Hyderabad. Today I'm going to talk about a procedure called percutaneous cholecystostomy. So whenever we are doing this procedure, a lot of patients and their relatives have doubts about how the procedure is done, what are the indications, what are the complications, etc. etc. So when do we do this procedure? So patients who are having complications of gallstones, especially the acute calculus cholecystitis, that is infection of the gallbladder or pus formation of the gallbladder or perforation of the gallbladder, that is contained perforation of the gallbladder. And these patients who come with complications who are very sick, especially some patients come in a very serious condition, that is they are critically ill, they are having multi-organ failure, renal failure, they are breathless, their BP is down, they are not having urine output, etc. These sick patients, elderly people who are diabetics, etc., are more likely to develop all these complications. Sometimes the gallbladder is just filled with pus, frank pus, and they are very sick. So for these patients, they are not candidates for surgery, and antibiotics may not be enough. So in such situations, we do this percutaneous cholecystostomy. So by doing percutaneous cholecystostomy, we put a drain into the gallbladder, directly into the gallbladder, remove all the pus and infected fluid, and this will help the patient to recover. So most of the patients they recover very rapidly after the procedure. All the pus is drained and they stabilize. The clinical condition will stabilize. So in unfit patients, surgery is very risky. So when we do this procedure, we will be able to tide over the crisis. And once we do this procedure, most of the patients will be able to come out of the ICU because the sepsis will resolve, the organ failure improves, they start throwing output, the urine starts coming up. So this procedure is a life-saving procedure, especially in those patients who are very sick and who have infection of the gallbladder. This procedure is also done in patients who are having protracted illness. They come late and who are not candidates for surgery and they are not improving with the antibiotics. Today I have invited Dr. Vamsi Krishna, who is the Chief Intervention Radiologist and HOD of the Department of Radiology in our KIMS Hospital, Gachibowli.
Hi, I am Dr. Vamsi Krishna, Consultant Radiologist at KIMS Hospital, Gachibowli. Today I would like to tell about a procedure for cutaneous cholecystostomy, which is a simple and life-saving procedure, can be done in gallbladder stones, where gallbladder is infected and the patient is not fit for surgery for time being. So usually it's a temporary procedure where we put a catheter or a tube into the gallbladder and get the pus out of the gallbladder till the infection gets subsided, and later on a elective date you can take the patient for the surgical basis. So usually the procedure is done in ICU or in an emergency ward and along the bedside, and under ultrasound guidance and local anesthesia you can do this procedure, and it's a very simple procedure where under ultrasound guided you can put a catheter into the gallbladder. Usually the procedure can be done within 10 minutes and the patient can be very much comfortable. Under ultrasound guided, we do a direct puncture into the gallbladder and put a tube into the gallbladder, and it will be connected to a outside bag so that the bile or pus can be collected into the bag, and it can be sent for culture and sensitivity, and you can look for whatever the organism grown in the pus. And the tube can be retained in the gallbladder till around some 2 to 4 weeks, and depending on the patient fitness, you can remove during the procedure or prior to the procedure and go for a cholecystectomy.
देने वक्त थोड़ा सा पेन लगता है, पेन एक मिनट थोड़ा सा दर्द लगता है, क्या करें?
Take from here, yeah. Don't show the patient. ಕೈ ತರಬೇಡಿ, ಹಾಂ ಆಯ್ತು, 10 ನಿಮಿಷ ಮುಗಿದೋಗುತ್ತೆ. 2 ನಿಮಿಷ ಮುಗೀತು. Wherever is seen. You can see, you can show that. So by doing percutaneous cholecystostomy, you can actually defer the surgery. You can postpone the surgery for a month or so, during which the patient improves and recovers from this acute problem and becomes fit for surgery. So that is why an interval cholecystectomy. This procedure is temporary. The percutaneous cholecystostomy is a temporary procedure. So this is done to tide over the crisis of infection and sepsis and its complications, and eventually the patient has to undergo a cholecystectomy, that is the removal of the gallbladder, after a period of 4 to 6 weeks. So meanwhile the tube is retained. Once you put the tube inside the gallbladder, the tube is retained till the surgery is done. The tube is connected to a bag, so the patient has to carry the bag. The fluid, the pus and the bile which collects into the bag is discarded every day. The patient has to keep an account of the volume of the drain which is coming out. So what are the complications of the procedure? Generally this procedure is very safe. It is a very short procedure. So the small complications like bleeding. So bleeding is one possibility. Generally we do the procedure and monitor the patient during the procedure, and before the procedure itself we are checking the coagulation parameters, that is the clotting parameters, PT-INR, APTT, clotting time, bleeding time, etc. This is a very small risk of bleeding. And second thing is sometimes the fluid can enter the chest, that is another complication. This complication is very uncommon or very rare because we are doing the procedure under ultrasound guidance. So this is not a blind procedure, this is done under ultrasound guidance, and it is very safe to do the procedure under ultrasound guidance.